One of the things Dr. McGraw does is help facilitate emergency protocols when needed. And as everybody knows, in the last couple of years, we had the COVID emergency protocols. In recent months, there's been a need to evaluate the need for suspending these protocols. And as of September 23rd, all COVID-19 emergency protocols will be suspended. This was announced recently by way of an EMS advisory. So before we get into which protocols are ending and which ones I should follow, first of all, we let everybody know via an EMS advisory. Bonnie, what is an EMS advisory and where can I find them?
EMS advisories were developed about 10, 15 years ago. We started sending them out when we really needed to communicate something important to our providers, our EMS coordinators, and we've been doing ever since. All of them can be found on our website, OCMCA.org, as well as on the OCMCA protocol app under bulletins. So if you click on the app, you click on bulletins, you'll find all the OCMCA EMS advisories.
You know, one of the great things about that app is that you can allow for notifications, and then the OCMCA can push notifications to everybody who has the app. So I have it downloaded so I can access all those protocols on actual calls, but I also have it set to receive those notifications so that when a protocol is updated and implemented into the system, I don't have to check my email. It's right there on my phone. There's probably a better chance of me checking my phone than my work email sometimes. So we just talked about the mechanism of the EMS advisory. Tell me why the OCMCA commonly puts out an EMS advisory.
We only put out EMS advisories when it's really important that everybody gets the information in their hands in a timely manner. Just like you said, not everybody looks at emails all the time, but you've got your phone, you got your app, and you've got it right in front of you. So it's very easy to be able to say, oh, look what the OCMCA put out today. This is important. And you get to read it right there in front of you. We share them by email with every EMS coordinator and chief and CEO by email so that they are aware of what's going on.
So the most recent one was EMS Advisory 58, COVID-19 protocols ending effective 9/23/22. Dr. McGraw, give us an overview of what these protocols were and why they're being suspended.
Well, thanks, Geoff. It's actually a good idea, I think, to kind of go back to where we were early spring of 2020. As we all remember, we were confronted with the emergence of a life-threatening pandemic that made not only everyone providing medical care in this country more vulnerable than they had been before, but we were also confronted with something that science had very little understanding of. In order to protect the people, as we had seen in where it had emerged earlier in Asia and specifically in Central and Western Europe, we knew that as this came across the oceans, it was going to impact us. But we didn't want it to have some of the same impacts it had already had, killing doctors, nurses, and EMS providers in Western Europe specifically. Because we had to sort of create policy with limited knowledge, admittedly, we put policies in place that were really designed to protect our providers and the patients that we cared for. These were things like the appropriate use of PPE, that the PPE had to be provided to the providers from the hospitals, just like we, exchange IV kits. We wanted to make certain that we had appropriate ways to decontaminate our vehicles, how to get in and out of the transport vehicle safely, and how to transport patients that seem to be symptomatic with the least amount of risk, although albeit we couldn't eliminate the risk, but try to minimize the risk as much as we could to the providers, especially to that individual provider in the back. That's kind of the total that impacted, I think, our providers the most. There were some other protocols that had to deal with transport or decisions when patients didn't want to be transported, how to affect that. But really, the ones I think the people felt the most anxious to get rid of were, having to wear a mask at all times around other providers or, in the vehicle, even when you didn't have an infectious patient. Fortunately, we've been able to eliminate those, and I think do so safely. But I also want to make certain that people understand when the original intent is to try to provide people for safety, since we still have COVID patients, we're really relying on people to continue to take their own best interest at heart. And we actually have a communicable disease protocol that it remains on the books, is very functional. And whether it's respiratory influenza or your patient looks like they may have severe COVID or tuberculosis, it doesn't matter if it's a communicable disease. We would still insist that you follow that particular protocol to protect yourselves and the people you work with. So this is one of those where I want people to be careful not to think that we're removing the COVID specific emergency protocols, but that takes away any requirement to do anything for communicable disease. We had a policy and a group of policies and protocols in place before COVID had even emerged on the scene in the end of 2019. And those diseases remain to this day. And I want people to look out for the safety of themselves and their partners at all times.
Thanks, Doc. So, John, protocol guy, bottom line, what does this mean for protocols? Those protocols go away. And as Dr. McGraw said, we're using common sense of when we do utilize our BSI. And obviously, that's probably in a protocol. Which protocol is it in, and what does it mean to me?
What it means to you, Geoff, is this basically. We're going back to where we were before COVID, and there were protocols on the books, as Dr. McGraw said. Protocol 8.7, communicable diseases, talks about when it is appropriate that you should be wearing a mask. And it indicates if a patient has a fever above 100.5 with headache, malaise, myalgia, cough, or shortness of breath, difficulty breathing, or talks about several different types of rashes distributed over the body, trunks, legs, preceded by a fever, you should consider the patient to be airborne and contact contagion, and the crew should don N95 or higher gloves, goggles, and face shields. And it should also be noted, whenever you're doing an aerosol generating technique in protocol 818, infection control, it indicates there that you should be wearing goggles. So we're only taking away a couple different things and a couple different situations, and we only added a few things that we should have been doing before.
So it seems like the COVID-19 situation and all the protocols that we had and everything we learned during that time helped to identify other routes of transmission that maybe we needed to shore up when indicated. So if there's a potential for particulate in the air, we have respiratory and eye protection because we don't want to give it a route of transmission. If something's gooey and wet and not mine, I'm going to put gloves on before I touch it. It's pretty much common sense, and these protocols have been updated and clarified, I think, to a more common sense and safer approach. And again, that's protocol 8.7, communicable disease, for those of you who want to look a little bit further. Bonnie, does that clarify it for us?
Yes, I think that's very clear. Also, any agency can develop their own internal protocol or policy that says what they want their providers to do. And I have been taking a lot of phone calls over the last week from those people to say, what should we do? And I'm like, if you feel it's relevant, develop a policy internally of what you expect from your personnel.
Just should be noted that this is the minimum. They can increase their level of coverage, they increase their amount of PPE that they're wearing. They can't do less.
So one of the things that's always good to note is that a protocol is law, it is rule, and it does provide the minimum expectations of care on scene for an EMS patient. But any EMS agency or titled at the state as a life support agency certainly has the right to increase the expectations beyond what is in those protocols. So as long as you're not breaking those protocols and those expectations are increased, that agency fully has the right to write policies, SOGs, or SOPs that would empower that. So if there's an agency out there that fully believes that their personnel needs to continue to wear masks on every call, that is up to that agency. But that agency can't tell them to not wear it when it's indicated by protocol. So it provides a level of safety that is a minimum that the agency can then identify and then go higher as needed based on the conditions of their patients. So speaking of common sense and policies, hospitals are still going to require you to put on a mask and put a mask on the patient every time you come into their hospital. Dr. McGraw, why is it different at the hospital?
You know, we, unlike the Medical Control Authority, have to operate in compliance with the state public health code. And until such time as it is changed, our hospital health systems are going to require this. I will admit, I think for some folks, it can be kind of frustrating because they say, look, I'm not here because I have any respiratory symptoms at all. I unfortunately have injury to my ankle, or I fell and dislocated my shoulder. The pushback on that is there are many people in our hospitals to this day that still have COVID-19. Now, they may be admitted for something else and then they test positive. That has not been uncommon, but some are genuinely ill with COVID-19. Not everybody benefited from the vaccines because their immune system doesn't make antibodies even when they're vaccinated. Not everyone was willing to be vaccinated. And we don't exclude people from our buildings based on whether they have or have not had a vaccine. We do, however, protect everyone we possibly can. Because remember, in a hospital, you've got two cohorts of people that I think are most worthy of protection. Those for whom their immune system doesn't protect them like it does you and I, as well as other people who probably are benefiting from an immune system. They don't have any symptoms, but may be indeed positive for COVID-19 unwittingly and give it to the group that I mentioned first. Because of that, every hospital associate, every visitor, every patient, every EMS provider that comes on our campus has to put on and wear a mask. If you don't have one, we'll obviously give you one as you arrive and make certain one is on the patient. But I understand the dissatisfaction people have felt. And believe me, I have people say, well, I'm just here to use the pharmacy. Why do I have to wear a mask? Well, it's on our campus. Our campus is up to the public health code. We and you are going to be compliant. Remember, however, nurses and physicians and people that work here for 10, 12, 14 hours at a time, we're wearing our masks the entirety of that time. So while you may not be happy to wear it for the short time you're on our campus, just remember, we have to endure it a lot more than others. And we do so because we're looking out for the safety of everybody.
Absolutely. Big box full of sick people. Makes sense just to put on a mask while I'm in there. You're not in there very long as the EMS provider. I get it.